lead us in another prayer?
Yes, sir.
All right.
Lord, thank you for this day, for being with us, watching over us. Thank you for the rain this week, or last week. And just please be with the commissioners as they make decisions, and please help them follow your will. Amen.
Amen. Could you join me in the pledge?
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
We are one, and we're in a regular Eastland County Commissioners Court meeting. For the record, we do have all commissioners, county judge here, do have a quorum. Also at the table are county auditor and deputy county clerk. Donna Robertson is here.
Thank you.
All right, so we've got a few items on here we need to get after. Read and sign the minutes. And here are the minutes that I see. August the 12th, August the 16th at 1:15, August the 9th at 9 o'clock. So I've got three sets of minutes. Is that what you have, Donna?
Yes, sir.
Gentlemen, do you have any questions or comments about anything in these minutes that we have here? All right, hearing none, can we have a motion to accept those minutes as presented?
Motion.
Second.
Motion made and seconded. All in favor, say aye. Aye. Any opposed, same sign, and that carries.
Oh, Loretta, here's your copy. Is that okay?
Yes.
Okay.
Okay, you have them all back?
Yes.
Okay. All right, item number 2 is discuss, consider proposed or pending contracts and agreements. And besides anything we might have on the agenda, I don't have any proposed or pending contracts or agreements presented to me now. Anybody else have anything to bring to us this morning? Okay, none of those, then no action on item 2. Item 3, and Ted, do you want to come on down and talk to us? Okay. Item 3 is discuss, consider the use of the American Rescue Plan Act funds to assist Eastland Memorial Hospital. Yeah, come on down.
Okay,
Did you want Ms. Williams to join us as well?
I would, yes.
Okay, we'll get a chair. There's one in the witness box there, Robert.
I've got one at your witness box.
Okay, sounds good. All right.
Calculator.
Loretta and I have been studying what we can and can't do with, let's just call them ARPA funds.
Yes.
There's I don't know, it's hard to decipher exactly what we can and can't do, but we've made some progress on it. Ted has got a need at the hospital that he stated to me, and so would you just tell us what the need is for the hospital?
I will, and I appreciate the opportunity to approach the commissioners. A couple of weeks ago, I was in my office on a Monday afternoon and received a call to testify at a Senate hearing the next day. And that was on August the 10th. And the senators, there were 9 senators there on a state basis, and they're kind of the heavyweights of the Senate committee. One is Lois Kokenhorst, who chairs the committee, and the vice chair of that committee is Senator Charles Perry. And so there were 9 of us through the state that were invited to have dialogue and to present and answer questions from these 9 senators. And the gist of the conversations had to do with staff shortages at hospitals throughout Texas, staff salaries that are now required throughout Texas, and the ability to transfer patients. And some of the individuals that testified, the first gentleman that testified was Neil Kidd, who is the chief executive and the director, and y'all probably know Mr. Kidd, a great guy, from the Division of Emergency Management. And then you had hospitals like Harris Health, you had Parkland, and understand these hospitals spend in one day what our hospital budget is for the full year. You had Houston Methodist, you had one moderate-sized hospital, and then you had Eastland. So I appreciated that opportunity to discuss what we're facing in rural health. And this all goes back to COVID right now. And we are just inundated, unfortunately, again with COVID. I can tell you that from August the 1st through August the 16th, our positive rate of patients that we tested that came through our ER in our two clinics tested for COVID, 5%. Over the weekend, 70% of our inpatients were COVID related, and these were sick patients. What we're seeing is that this new variant, we assume it's Delta. We don't quite have the technology to drill down to determine that. We do know, though, that everybody is positive, and a lot of respiratory issues. We have patients right now that are on vents, that are on. So that was a part of our discussions. The other big issue that we're facing is that no one can transfer patients out. So if I'm sitting here with a cardiac issue right now, or maybe a bleed of some kind, I'm probably going to be treated in my clinic, where in the past we could transfer patients to higher levels of care. And so that was the gist of these discussions. And the senators wanted to know, like Parkland, well, you have whole floors, critical care beds shut down. Why is that? And it comes back to staffing. And what leads up to those staffing shortages has to be with salaries that are being offered. And I have documentation in here. Understand I shared this at our hospital in rural Texas. If you have an RN, that the salary ranges somewhere between $30 to $40 an hour. Now, if you get up close to $40 an hour, we're having to beg, borrow, and steal, because in our budget that just far exceeds the resources that we have. So our average salary is going to be somewhere around $33 an hour. I also have documentation in here that nurses are leaving areas, and especially rural areas, and going to the Metroplex, and they are making anywhere from $80 an hour to $120 an hour. And that was presented in testimony at these large facilities. So basically, I can have a nurse working a 12-hour shift and make $330 or so, or they can go to the Metroplex and make anywhere from $700 to $900 on a 12-hour shift, and more than what I'm paying them right now. So this is creating huge issues. Now, we can discuss market economics all we want, but that's where we are. And so where we are located geographically at our hospital has a huge upside, because we get a lot of patients from the Abilene area. We get a lot of patients that come from our hospitals from the Metroplex, especially from Weatherford and all, because we provide exceptional care. The downside is it allows our nurses that we have to go to those places. It's an easy drive, whereas if we were in a more remote area, that would be more of a challenge. And so that Monday when I left, I had a nurse that had been in our ER for a long period of time, an RN, worked at night, that was just an excellent nurse. And she told me, she said, Mr. Matthews, I'd love to stay here, but she said, I can double my salary, and I'm going to have to do that for the family. And I understand that. But what it has created is a critical shortage at our hospital. And last night I was on the phone, and this morning at 12:30 with our chief nursing officer and with the manager of both of our med surg and our ER, and both of them were on the floor in our emergency room working last night, because we are now staffing these positions with basically any RN that we can find. And we're also trying to get agency nurses here at a very, very expensive cost. So with that said, we had some dialogue, and especially Mr. Kidd, about, well, how can we approach all this and get some more funding on a federal basis to these rural hospitals. And we have. We found some FEMA funds, and Mr. Kidd was instrumental in getting that put together for us. We do have some funds, we believe, coming in from the American Rescue Plan on a federal basis from Biden. We don't know when those funds are coming, but to help with staffing shortages. But one thing that senators recommended at this was go back to your county, that counties do have American Rescue Plan funding, and talk to them and see if they can give you some immediate relief. And that's why I'm here right now. So we implemented a shift differential, and we entered a weekend differential to try to keep our nurses. On August the 15th, we stepped up and put a COVID hazard pay funding mechanism in for all of our employees. And basically the way that works is if you have direct patient care for a 12-hour shift, you will make $100 more for that 12-hour shift. And that comes to about $8.33 an hour more. So now we have all these blended rates going into overtime, and let me tell you, it's becoming very, very expensive. Even before COVID started, about 49% of the hospital's expenditures went solely toward pay and benefits. So you can imagine when you increase that by those percentages, what it's now costing us. And it's just a huge financial strain. I was here this weekend. We've had nurses that are working 6-7 days straight on 12-hour shifts because we're short of nurses. And we can't even get all of our agency nurses here that we're needing. So some real challenges out of the hospital. We're still providing that great care, but it's starting to cost us. So I had these discussions. Do you want to go through some of the hours real quick?
Sure. I printed off a hours worked report for the time period was July 18th through the 31st. And we have, as Ted mentioned, we're just short-staffed in a lot of areas, which is creating, and what people would typically work about in 80 hours within that 2-week period of time. We've got upwards of 140 hours. And it's just, from the people perspective, it's just not sustainable from a long term. We need to be able to get additional staff in, make sure we have some relief for these folks so they can continue to provide the quality care that Eastland is known for. So.
And it's just not nursing, it's respiratory therapy, a huge shortage for us. It is our lab, those lab techs are working around the clock. It's radiology, it's every department we have at the hospital right now. And we're losing some key individuals from all those departments, which are kind of creating these challenges for us. Now, we do have nurses that have been with us a long time that are staying, who are working the 6 and 7 day shifts to keep our hospital going. And so I had some conversations, since that was a suggestion by the Committee on Health and Human Services, the senators of Texas, who took a lot of these recommendations directly back to Governor Abbott. And so we saw some relief coming, and we appreciate that from the state. We have 4 nurses that we were able to get, the state's providing us 2 to work on the med-surg floor and 2 to work on the ER floor.
And that's additional people that are coming in.
Yes, they're coming in, and they're picking up that cost, the state, at least to the end of September. We don't know what happens after that. And our med-surg nurses are here
They're
now.
here, and then the 2 ER should be here by the middle of this week, the 2 ER nurses.
Which is really helping us also.
I got these 2 emails last week, and one discusses FEMA for hospitals, and you said you've already talked with FEMA about help through Texas Division of Emergency Management. You've already talked to them about that.
We have, and we have been
Okay.
registered, and I appreciate Judge Fields' help on that. Judge Fields and I, he's a great supporter, as I know everyone here of our hospital.
Get a little closer to that microphone.
And we have worked so well together on things, but yes, and so,
then also, John Henderson is the president of Torch,
yes,
and he says that in this email that I received from another county judge, not me, that says notification of hospitals they'll be getting 85% of what they got in May of 2020 very soon, maybe in the next 30 days. Says that HHS is allocating $8.5 billion from the American Rescue Plan, to make up for lost revenue amid the pandemic. Now, you've already,
We are all over
You
that
talked about that
also.
as well, okay.
I'm on that torch board as
Okay.
well, and we jumped all over the FEMA. I mean, I'll tell you what, that was probably the most important discussion that Mr. Kidd had at that Senate hearing where he released that. And understand on our agency nurses that we have had to get here. So we're going back to the first pandemic. Now we're in the midst of another pandemic, or another pandemic, another COVID outbreak, that we looked at those agency nurses, and it's going to take us a while, but we're probably going to submit invoices in the range of $480,000. Agency nurses.
your
were just
problem is
so
you're
expensive.
requesting all that, but you're not sure when that's gonna happen, so
No.
you've got a cash flow issue going on.
We have a big cash flow issue. And so right now with our COVID hazard pay, it's costing us $8.33 more per employee before we even get into overtime. And so I would like to approach the commissioners to see, and I know there's no clear definition on a federal basis on the American Rescue Plan and how you spend those funds. We feel that because when we receive CARES Act funding and the hospital received something like $3 million, and we've done all these renovations and put in separate HVAC units to limit the spread of COVID going to other rooms, and we've done a lot of things with that. There was no guidance, and still no guidance about whether these are approved expenditures or not. But you know, we just had to step out there and do it. And because if we wouldn't, we would have a horrible mess on our hands right now.
Loretta and I have spent some time on this, and I don't know, I've got information here from, Texas Association of Counties, from, National Association of Counties, from the United States Treasury, and it talks about eligible uses of our funding. And it says, now this is a kind of a draft that was sent from TAC, but they're using information that's in the actual, this is the interim rules, the compliance and reporting guide for the interim rules. It says American Rescue Plan gives counties flexibility to decide how best to use coronavirus state and local fiscal recovery funds to meet the needs of their communities. Treasury guidelines allow broad actions by local governments to support the public health response to the corona pandemic. Several more that don't apply to the hospital. Provide premium pay for workers performing essential work during the pandemic. Premium pay is defined as an additional amount up to $13 an hour with a cap of up to $25,000 for any eligible worker. It can be retroactive. And then invest in water and sewer infrastructure and invest in broadband infrastructure. Of course, there are lots of restrictions. Counties can't deposit the funds in the pension program, can't pay for debt service, can't deposit recovery money in rainy day funds for the county. And Loretta, I'll turn it over to you and you've got a report that you kind of put together there about our eligibility and what we can and can't do after we did a bunch of research on this last week.
Well, and this is training I sat through last week, and the eligible uses are respond to public health emergency with respect to COVID or its negative economic impacts. And then they break it down farther into allowable use and payroll costs for public health, safety, and other public sector staff responding to COVID-19 is definitely one of the allowable uses. So I think if the court wants to use the funding toward this, it's allowable. And like Mr. Matthews said, at some point, we're just going to have to do the best we can to comply with what's already in place and just keep records on what we went by.
And the rules that we have to comply with are the ones that we can find right now.
Right. Now, I did see in your email from Friday that it said something about final rule, and I was just very happy about it, but I didn't research it. I was
Interim
working on
final
budget.
rule. They opened it up for comments from the receiving entities about how it might work better. We didn't make a comment on it. But,
Okay.
It should be an interim final rule. That's the one that I didn't print out because it was several hundred pages.
Oh, that's the one that,
Yeah.
okay.
This is like a synopsis of everything that we have so far that we can look at and say, these are the allowables, this is what's eligible and what's not eligible for this. Loretta had an idea that we might have to keep up with the Bacon-Davis or Davis-Bacon, I always get that backwards, about the rules for that. We've had to do that in the past when we use CDBG money for
Yes.
funding. I don't know if I don't see that in here anywhere.
Well, that's the 2 CFR 200, which is the Universal Grant Management. But I think that applies to if we're hiring somebody to do a job for us, they have to comply with
Oh, like if we
Davis-Bacon.
had to hire an administrator.
Well, we hired a
If
contractor.
we, yeah, hired a contractor.
Right.
Yeah, this is not, it's not to
It's not-
assistance.
It's not to an eligible recipient.
Right.
Okay. Yeah, cities have to go through the state to get their money if you're under 50,000 on the cities. And they typically have to hire an administrator to make that work like we do, doing some kind of project for the water district or whatever. But the money comes directly to the counties.
And I visited with the city about this as well. I visited with Judge Fields. I believe JJ's response was, well, at this point, we haven't received any of those dollars. I think he said we received $140,000 back in December to cover reimburse us for some expenses, and I believe they're entitled to about $800,000 coming in at some point.
Yeah, but they just got released like Wednesday or Thursday.
Okay.
Yeah.
The last week.
All 6 incorporated cities are getting money coming in. Eastland gets $840,000.
Okay.
Cisco gets $830, and it'll be like ours. It'll come in 2 different payments.
Okay.
But I think they didn't release that until like last Wednesday or Thursday.
Okay, good.
Because they're going through it comes from the federal government to the state, Division of Emergency Management, and then the grant administrator's got to work that out to make sure they're compliant. And Loretta and I have talked about getting a grant manager for us. We think it's just going to be something else maybe that she has to send paperwork to them and then they send it on. It's just kind of an extra step. We don't know if we're going to do that or not yet at this point, but.
So I guess our request is, can you help us with this? And we have actually carried it on our books as the hazard COVID pay. And this is costing me $8.33 at this point more an hour than what I'm for a 12-hour shift. So if you're making $30, you're going to be on that making $38.33. If you could help me with that, and honestly, gentlemen and ladies, I may have to go up on that from $100. I mean, that's a huge step for us to even come up with this kind. Understand our hospital, to operate our hospital for 24 hours, every day, 24 hours, it costs $44,000 every 24 hours. Click, click, click.
You're not asking us to pay anything retroactive. You're asking moving forward to try to
Well,
get
maybe
keep
at
the people
August
here.
the 15th, Judge, forward, because that's when we put this into play.
Okay.
And maybe through the end of the year,
Which calendar or fiscal?
calendar.
Calendar.
Through August the 15th through the calendar year of December the 31st, we'll reassess. Hopefully, let's all pray that we're not still battling COVID. And maybe not to exceed a certain amount, or maybe whatever. I'm not wanting to an unlimited, draw on your part. Maybe 200,000, not to exceed 200,000 through the end of the year, which would just, and maybe we won't get to that. We could turn in statements every 2 weeks and show you
Well, we've got to do a
exactly.
reporting, and our first report is due the end of August, and it's a reporting period of everything that we've spent, which is 0 at this point,
Okay.
through the end of July.
And we could get that. Actually, we put it in on August the 15th, but we had, I don't have my calendar, go back to August the 15th was a Sunday, but we had to go back a few days to that Thursday and go ahead and put it in because we had no nurses for the weekend. So,
This is my problem with that the paperwork. We already have a deal with them to get quarterly reports on the ambulance, and we don't get them. So, have you ever even seen one? I was wondering.
We
So,
just get them once a year.
yeah.
now what, we
Quarterly
give you the
reports from the
audited
EMS.
reports or?
We don't.
We can send you financials every month. We'll put you, I know.
Well,
we'll be
quarterly
glad.
or monthly would be good. We don't get those.
We don't get those.
Okay.
And it is in the contract on the ambulance service that we get them quarterly.
Okay,
And I'm not saying not that we can't spend money on that. I'm saying you're putting a deficit deal on Loretta or whoever's having to maintain that. If she's having to call you every week saying, I gotta have this, I've gotta have this, I've gotta have this.
Loretta, we will
And-
make
and-
sure.
Absolutely.
The paperwork bothers me from that standpoint because
Yes,
I've been here 10 years and it's never been consistent.
Well, we will step
We
forward
typically
with
see
that.
those once a year when
When we
they,
had budget.
yes.
And this is just on ambulance services?
It's just the EMS, yes, ma'am. We
Okay.
have a contract from the county to the, it's called a cooperative EMS. It's City of Eastland, City of Cisco, Hospital District, and the county. So there are 4 entities in that EMS cooperative.
Okay.
So we will do that, and we can even, if you want our financials on a monthly basis.
Well, it's
but
just the financials for the EMS. That's
Okay.
only, that's only.
That's
thing we
all
have
that's
contract on.
asked in there.
That's easy. We break that out every month, and I'm sorry, I'm sorry that wasn't being sent. It was supposed to be coming.
It's in the contract.
Yeah, it
I've
is.
just
So we
never
will get
pushed it.
that to you. We will get that to you, yes.
You know, we have board meetings. Typically, that's where I see that would be at a board meeting. We haven't had a board meeting with EMS in quite some time.
We haven't.
And, you know, I don't want to have a board meeting if there's nothing to discuss. That's a waste of everybody's time, but
The-
we do
the
need to
good
get those
news-
reports in.
Right, and we can do that, and we need to have that, you're right, we haven't, because that co-op that stayed the same, and we've been able to keep it at that amount.
Well, I'm just looking backwards and looking forward at the same time. If we're not already getting financial paperwork from you, that's very simple paperwork. Sometimes on the federal stuff, it's a little bit more complicated,
sir.
you know.
Oh,
on
we
that.
know, yes, sir.
That it's gonna take some, providing the information that's gonna be necessary for the reports.
So what I can do, our fiscal year began, we have year end June 30th, so I can get you that information for July and August. I can go back further if you want it, but
No,
start then for where we are on the EMS. I mean, I have that in the financials.
Let me ask you something too, and I don't want to jump in the middle of with your.
No, you're fine.
Let me ask you something about, you want to just do this extra pay for your nurses, right?
No,
To keep
sir,
from
it's
No.
for all of our clinical. It's anyone who has direct care, so we pay $100, and then we pay, that's for direct patient care. You go in and you have face-to-face, so you're looking at radiology, you're looking at
How many
lab.
people is that, Mr. Matthews? Roughly, I don't.
We have
I know. I'm still learning the org structure, so I don't know if I can be very specific with that. But we have it indicated by department for the direct patient care and then the indirect patient care as well, like housekeeping and things like that. So I can follow up with this meeting and give you a head count of which ones are eligible for the $100 hazard pay, and then the indirect care we've
are at $50.
are at $50.
We have
For sure.
So let me
100.
just go back to my question then. So it's nurses, it's techs, it's the maintenance staff, it's everybody that might be
Everybody.
exposed to
Right.
the virus.
Now-
It's actually working. It's not administrators.
It's not
It's-
administrator,
wait,
it's not
it's-
accounting,
it's-
it's just whoever comes in. We have 134 FTEs at our hospital, and it wouldn't apply to any agency nurses, only W-2 employees at our
Agency nurses
hospital.
is somebody that's sent in here extra. Typically, we've done this in the past with, when we made a star request and you got some
Yeah.
eligible staffing people that came in and do that.
The nurses coming in, these 4 that we have coming are from out of state.
So it's
and the
all of your
state.
people that actually work with the patient.
With the patient that has face-to-face. And,
Okay.
again, we had 70% over the weekend were COVID, so it's all those individuals that clothe up and hang their stuff and go in, and it's respiratory. It's every direct clinical, you draw blood, do chest x-rays, just whatever.
Okay, what about food service workers that have to go in and take the food in and out of the room and all? I mean, I
normally-
want some kind of parameter about who we're talking about.
And I can get that to you, Judge. I have a list of who that is, but it wouldn't be that, because we try to limit those folks who go in, so
Sure.
those food employees, we have a large container, and the nurses actually carry that into
Okay,
those rooms.
okay.
We don't even let visitors,
I think the
patient
commissioners
visitors
and I
in
want
go.
to kind of a ballpark figure about who are we talking about the extra funding for.
And I have that. I can tell you exactly the departments, and then I can give you an idea of, in fact, we have it's not this week, it's the next week will be our first pay period where since we've put in this.
It's not my problem, and it won't be my problem, but is this gonna create animosity within your hospital about administrators, HR people that don't get the premium pay?
You know, we have good explanations. I mean, I think everyone's here. There's always some of those issues to deal, but we have to, if we don't put in COVID pay, we're gonna have to go on divergent, and we're not gonna be able to take care of
Now,
patients.
divergent means you can't take people to the
We
hospital.
can't take, and we can't
They have
do
to go
that.
somewhere else.
And the problem is, we can't transfer people anywhere right now. We're doing a remarkable job, but we kept a lady, I had to be careful because of HIPAA. That Monday when I was leaving, we had a patient that was intubated, that was on a vent, that had been in our emergency room for 41 hours. And we could not get her transferred. Now, I've talked to other hospitals in the state of Texas. They're transferring patients to New Mexico, to Louisiana, to Oklahoma. They can't transfer them anywhere. Everything is full at all the hospitals. And so we are doing a remarkable job of taking care of patients, keeping patients alive, and treating those patients in our hospital. Under ideal conditions, a number of those patients, we, on a historical basis, transfer about 41 to 42 patients a month out of our ER that needs to go to higher level care. Understand, we see somewhere around 750 to 800 ER visits a month. But those 40 and stuff, occasionally we can get them out, but for the most part, we're keeping them here and treating them ourselves. And our ERs are full, our beds are full. We have plastic hanging in the halls. If you come into our hospital, you're going to see on both halls plastic. And we have our 3 COVID rooms that have vent systems separate, full, and then we have plastic hanging down the halls.
Well,
And
I think the
I wouldn't
commissioners and I,
advise you
I think the commissioners and I and Loretta are gonna need to know, we'd like to know what kind of money are we looking at
to
here?
understand.
I mean,
And-
I
and
don't
we
know,
can
and I'm
get
just
you
talking
that.
for myself at the moment. I see where it's an eligible expenditure, at least under the rules that I had as of the middle of the week last week, it's an eligible expenditure. And I don't know, commissioners, what do y'all think about pay, premium
We
pay?
call it
Premium pay, wait a minute,
I'm sorry.
premium pay for essential work. So what's, all you commissioners, give me an idea. I know Robert and I guess we tend to be the big talkers anyway, but
I guess
y'all,
so, Judge.
or at least one of us does.
Yeah, I won't hold that against you.
Wait a minute. So, I don't know, guys, what do y'all think about it?
So where are we getting the money? Out of the budgets?
No,
No,
it's out of
we
the
got
grant
it.
fund.
This
Out of the
is the ARPA funds, the American Rescue Plan Act funds, that we already have them in
Yep.
our account. I just haven't certified the revenue because I need direction on,
Which way to go with
yeah,
it?
and we'll talk about that on the next item.
Okay.
But
In
these
one of
are
the
funds
budgets,
that,
we just put that in there about the items in there. We funded it with just a few dollars, so we have the ability to spend it if we need to.
And it's for stuff like this, Ms. Loretta. I think it's a good deal, as far as I'm concerned.
and as far as the
Yeah.
records, and I'll tell you, and I'm just gonna go by the last FEMA grant we had. What we had to provide was timesheets. We had to provide,
Pay stubs.
pay stubs, and we had to provide bank records showing those cleared the bank.
Okay.
Okay.
They had to
So,
verify they worked, they got paid, and they actually got it out of
And
the
they
bank.
got it, yes.
And that's per individual, per
Yes.
employee who
Yes.
receives it?
We can do that. We can do
and,
that.
and there's also a spreadsheet that I have to do calculating the pay and the benefits on each employee. So, but it would be basically, when that was all submitted, then we'd write a check.
And be
Correct.
prepared for the rules to change midstream. FEMA has done this
We
to us.
understand.
And this is not from FEMA, this is from the Treasury Department, but all of us involved here, the 6 of us that work with this all the time with FEMA, the rules change monthly sometimes. So just be prepared for us to say, okay, now we need the XYZ form for 30 people. So just be prepared that we may have to come back and do that. Now, Andy, Ronnie made his opinion. What's your opinion of the use of ARPA funds for the hospital?
Well, I'm just kind of worried about what comes down after that. Like I said, if they change this up saying you can't use it for this, then how are we gonna, technically pay that money back?
Maybe we need a contract with them. If we've got to pay it back,
I mean, that's what they told us, if we don't have our stuff right, when we had all the FEMA stuff, if we don't have all of our documentation right, then they're gonna cancel it and we have to pay the money back.
Yeah.
I don't wanna be caught with that.
That'd be the concern.
That's
your
a lot,
concern too?
Yeah.
that's a lot to do with the paperwork. Yes, we were told we were gonna get quarterly deals. We did not. But we were told them that we would get them. We didn't get them.
well,
I understand it's just something that may have just been overlooked, whatever. But you were talking about a lot of money that we're basically online for.
What was it, like 800,000 is what you were saying?
No, I believe the county has received $1 million.
We
Million
received
seven is what we got.
1.7 million.
And entitled, I think we're gonna get another million.
Another
Judge?
1.7
But
million.
you're
They said it
asking
in two
for
equal payments.
800,000.
No, sir, no.
Two.
A couple of 100,000.
Oh, I thought
And
you
we
said
put, and that was what we think the city's going to get.
City's gonna
Yeah.
get 840,000
Yeah.
for City of Eastland.
Yeah, so, and we have just put this hazard pay in, we do it over 4 weeks, so it goes from like August the 15th to the 11th or so of September, but we anticipate having to keep this in probably through the end of the year. Hopefully we don't, once we don't have this COVID, the hazard pay goes away, and that's when it would stop, so, we can give you those numbers.
And I understand that. But there was also an issue come up on some other people that had the same deal that wanted to go with a hazard pay that were told no because they knew what their job was.
I do.
No matter what the changes were that came along. They were told they were hired for a certain job, but they had to do it regardless. They didn't get hazard pay.
Yeah.
And so I do have an issue with that.
You're talking about our own employees.
Yes.
Yeah.
They are frontline workers, but they didn't get hazard pay. They're not getting it now. So I see both sides, but I do have an issue.
well, my other deal is, and I've talked to him about this, is in the last week, we've seen the federal government tie Medicaid, Medicare to mandates, and we've seen them tie the ARPA money that the schools receive to mandates. What are the 5 of us gonna do if they tie this money to a mandate?
Exactly.
And you're
So,
talking about a mask
a
mandate
mask or
and a
vaccine,
vaccination
yeah.
mandate.
Yeah, mask mandates at the school, vaccination mandates at the nursing homes.
When you talked to the senators, was there any discussion back from them about mandates?
I did. I was asked that specific question by one of the
Okay.
senators. He said, "Mr. Matthews, are you going to require vaccine mandates at your hospital?" Now, we do require everyone to wear masks, but he was
Right.
talking about the vaccine. I did respond to him. I have an executive order. We are a governmental entity, our hospital, from Governor Abbott, that says I cannot mandate that. So I am not planning, and I have no intention of mandating it under that governmental order. Now, if CMS, who's Medicare and Medicaid, come out and say this is a condition of participation, if I didn't do that, I lose my Medicare, Medicaid number, and that closes my hospital.
Yeah.
So they have my hands tied.
Yeah, yeah.
I can't tell you I'm not taking a political where I
Yeah,
stand politically,
you're
but I'll have to
getting pulled
do
from
it.
both sides
You will,
on that
I
deal.
will have to do it in
School
order.
districts are getting that same rock and
They
hard
are.
place situation.
Yeah,
I heard that, they have mandated it for nursing homes,
Right.
and that's going to create, they were already having staff shortages, and that's really going to create issues. We have 2 nursing homes, well, we have more than that, we have 4, I believe, in the county, but 1 in Eastland, 1 in Cisco. And those are big issues. They did stop short on education and hospitals. We don't know what's coming. If we can turn this around in the next 3 and 4 months, maybe maybe there won't be this crisis that we're now facing. But y'all, this is more contagious. It's affecting younger folks. People are much sicker. I can tell you that of all the positives we're seeing, and I have the data to back this up, that 92% of the positives we're seeing at our hospital have not been vaccinated.
Wait a minute, let me get that again. 92% of the people that are presenting with COVID have not been vaccinated.
That's correct.
Okay.
Have not been vaccinated. Now, that's individual choice. I'm not getting in that fact, but
Right.
but I can tell you how many we're seeing. It's about 6% are catching it a second time with mild symptoms, but closer to 92 point something percent have not been vaccinated. Honestly, if I was dealing with that 6%, I wouldn't have an issue. I wouldn't have this crisis point at my hospital. You can go to my clinic right now, walk in and get vaccinated. We have the Pfizer, we have the Moderna, we're out of J&J, but that I'm not getting in that. But yes, I was asked that numerous times, and we have an executive order right now.
I think before we take any kind of action, again, this is just me talking. I know I talk too much, yes, thank you. I think we need to know some kind of numbers. Or you said you need a premium pay of $8.33. Is that what you're asking for? Or are you asking for more than that?
No, what I would say.
How
I'm
long
sorry.
are you gonna go with that? Do you anticipate telling us maybe we're gonna go 80 days, 90 days, 180 days, and then we're not going to go over a certain dollar amount? I think before we make an intelligent decision, we need to know what the dollar amount's gonna be and how long this is gonna go into effect.
So we do this, so there are some variables there and some constants. I can tell you that when it is scheduled to end on September the 11th, I believe, but I can pretty much assure you that we're going to have to extend it another month, 4 weeks, and another 4 weeks. What I would ask for the county not to exceed the end of the year, and I can give you those dollar figures. And we are hoping we have this. We don't know when we're going to have this turned around. It could get a lot worse. It could get a lot better.
Do you think that we'll retain the nurses if we spend the county's ARPA funds through the hospital? Do you think that will retain the nurses and keep the hospital viable? That's really what I'm concerned about.
Yes, sir. I think it will help, Judge.
Okay.
But, when we're talking $8 more, and so we're getting up into that $40 range, and these nurses, we have some great dedicated employees. So I think it will keep us viable. Do I think we'll still lose individuals that are going to be making $120 an hour in the Metroplex? I do. It's just,
Well, we can't,
and it's
our hands are
devastating.
bound to $13 over, so
And
we can't go any further than that.
Yes, sir, and right now, I'd say we're at $8, and I might have to come, and we'll give you the numbers. We'll have that next week when we do our first pay run on this. I may come to you in a month, and we can start out at $8.33, and I may come to you, but I do understand you cannot go above 13. And we're very good stewards of our dollars, and extremely frugal. We always buy used everything if we possibly can. I can't tell you. I understand. If it gets much higher than this, I'm not sure what we're going to do either, Judge.
We've got another meeting,
Okay.
we've got a special meeting coming up to pay the bills.
The 7th at 1:15, I think.
The 7th, because we need to pay the bills before the 10th. Our first meeting in September is the 13th, and the next one is the 27th. We're gonna adopt the budget today and get through this, so we shouldn't have any more of these extra meetings except for that one to pay the bills.
I'm
On the
looking.
7th. Do you think you can get us some numbers by then?
Oh, absolutely. I believe I can have the numbers to you by today's the 23rd. Yes, I will. I can definitely have
We
you
can't
for
take any
this
action
period.
until we go into another meeting about
Okay.
this. And I don't know, I guess this is maybe more informational than anything else, but I want to kind of get an idea of what the commissioners thought about it.
James didn't get to talk.
Well, he did say. he had
James,
the
your
same
turn. I
concern.
want to hear something.
Well, I agree. I agree with what Andy was saying.
Okay.
That a lot of these people are not gonna get it. It's working for us.
But the money, I understood, ain't for the people that work for us, is that correct?
No.
Well,
Well,
No, it can't
Oh,
be.
it can be.
Yes,
it can be. for
It
us.
says
It
right
can-
here,
it can
Ronnie,
be, yeah.
it says
Okay.
provide premium pay for workers performing essential work during the pandemic,
All but elected officials.
not the elected officials.
But all the other employees.
And there is a pay maximum on that too. So if they earn over a certain percentage of average salary for the area or the state, so there's calculations in there also. But their premium pay is one of the categories.
Oh, okay.
And I would say, from the hospital perspective and the county's perspective, if we do a premium pay, the employees need to get used to the fact that they shouldn't get used to the extra money coming in, because when it's over, it's over.
Yeah.
Robert and I talked about this on the way in this morning.
Oh, yeah.
Don't get used to that bump in pay, because it's not gonna continue.
And I think
Once this is spent, it's spent.
it's really important to outline that criteria for employees so that they're aware that it's in addition to, and it's time-based. And so far, from the hospital's point of view, we've only communicated that the incentive pay or the COVID pay is through September 11th. And then at which point in time, we'll need to reassess and make a decision if we're carrying it forward. So I think it's a
So
good
this-
point. We have to make sure that people don't see it as an entitlement.
So this pay is just from August the 15th to September the 11th?
Currently, but we do anticipate having to expand, so we do it 4 weeks at a time. And we do expect, based upon what we're seeing now, that when September the 11th comes, we'll have to put it in for another 4 weeks. And then now, when that number starts dropping and we're wanting it to, and we no longer have this crisis, we're good with it. But we do not see this turning around anytime soon, just because there's so many.
Do we need to have an MOU or something in place between us and the hospital?
You know, it doesn't say anything about that. We have to submit these reports, July the 16th, 2021, with a deadline to comment on the treasurer's interim final rule, which is what Loretta was talking about earlier. That also the end of July, the last day of July, which is the 31st, we have to send in a report by this 30th, August the 31st, about anything that we've spent through July, which is zero. Loretta's got that set up where she can make those reports. We've got to fill out a plan. We've got to hit a deadline on October the 31st to submit project and expenditure report. This reporting applies to all counties. On December the 31st, by 24, deadline for counties to obligate all recovery funds for specific projects and programs or risk having the treasury claw back the funds. December the 31st of 2026, deadline for county to spend all recovery funds and complete all associated projects or return the funds. So there are some deadlines we've got to meet in there on what we do and how we report it back to the treasury. We don't go through the state, we go directly to the treasury. And I appreciate Loretta setting that up. She had to do a lot of extra work to get it set up where she can make the reports and make the request. An eye scan was involved.
It was a facial scan.
Facial scan was involved.
Wow.
So that they know that she's the one submitting the report back in.
But I understand it was nothing new. They were just confirming, so they already have my face somewhere.
I would think your driver's license would have that real
Yes.
easy.
And the sheriff's department,
Like this.
Some watch with it.
With a number.
Okay, so how do we want to move forward here on this? I know, I think Robert and Ronnie are in favor of it. James and Andy maybe want to be reassured about some things on it before we move forward. I would like to see, it looks like it's eligible. I'd like to see the hospital get some help if we can do it. It looks like we can do it.
Well, I
With
don't
a lot of
mind that, yeah.
documentation, a lot of documentation on it.
Yeah, that's, the documentation worries me. You say you're
Yeah,
gonna get it,
yeah.
I'm good with that. When Loretta calls me and says they ain't giving it, I'm gonna call you and you're not gonna like that
Now,
conversation.
you know what? And I would deserve that call. Just so you call, don't come punch me in the nose.
Ben, did you not know we're not getting EMS reports?
I thought we were. We had that set up at one time that it was to come to the treasurer? Who did it used to?
I think in the contract, does it say me?
I don't know if it's,
But I
I don't know
will
if it's
make
auditor, the
sure.
treasurer, or me, but somebody over here's got to get it, just like we do our fire department reports.
About
We don't-
10 years ago or so, it came to my office.
Yeah.
And we-
There you
We changed it where it didn't come to my office.
Okay, and so I will get that back in place, and you will have that from our fiscal year, which started July 1, and we will
See-
make sure, Loretta, okay.
Ted, we make a presentation to Commissioners Court on all those kind of reports that come in once a
Yeah.
month. It's called
Okay.
financial reports.
Yes.
And so we do those that come in, and we'd like to have that one from the EMS.
Well, you know what, absolutely, and I apologize.
And you need that before September 13th. That's the next regular.
As soon as possible,
Okay.
Yeah.
yes.
Do you have?
You can just email it to us, that'd be
Maybe
fine.
it doesn't have my email.
I'd like to give it to the
I'll-
commissioners so they can have it.
Okay, if you could email me, I'll give that to Amy, and we'll make sure that, it's a one-page report, and we scan it, and it shows revenue, expenses, 911 calls, where we are, and all of that. So
Okay.
it's a pretty simple report, but it's a great report.
Okay.
It's easy. We will put you on that distribution list.
Okay, thank you.
Okay. So,
And then my only other deal is
Send me
an
that.
MOU of some sort. Do you think we gotta have an MOU of some sort or something in writing saying that we're providing them the money?
I'm not an attorney, but I think it's always a good idea to have an agreement in place.
I think it sets the boundaries.
we're gonna provide these services, and here are the reports that we're gonna get back. Here's what's, the
Yeah,
services are
we're
gonna be
gonna
used for.
provide, yeah, we're gonna provide financial, and here's what we expect in return.
Hoffman could draw up an MOU between the hospital and the county for use of funds. A use of funds MOU should be something that wouldn't be difficult. He could draft that up.
Okay.
That says the county is supplying these dollars for premium pay. In return, we're getting the reports back, we're getting all the information, all the documentation that we need, and it'll continue from this period to this period. Something along those lines.
Okay.
I like the fact she's taking notes.
Yeah, that's why Amy's here. She will get them. She will be on this, y'all.
Because I can't remember anything.
That doesn't get better.
Well, thank you very much
Okay.
for your time, and let's just hope in a couple of months this is over with, and.
I think
things are
we'll just
better.
put it back on the agenda for the 7th, and by that time, you'll have some numbers on it, so we can make a hard decision about whether or not we're gonna do it.
Yes.
I think there's probably support here to do it with the proper documentation and a good exchange of information both ways.
And please always feel free to contact me if y'all aren't getting that information. I thought, anyway, we will get that to you, and appreciate everyone, and thank you for your time.
Okay, all right, thank y'all for being here and explaining it to
Uh-huh.
us.
Thank you.
I'll give you your chair back.
No, I'm good. This may not survive me anyway.
Okay. The next item, and this may be something, I don't know that we need or not. Christina brought this to my attention. I appreciate her doing that. She was somewhere and heard that the reports that we need to file have to be approved by Commissioners Court. So I kind of scrambled Friday morning and sent out this amended notice of the meeting to go down here to item 4. I'll wait till Ronnie gets back in here so we can talk about it with everybody in one place, but I don't think we've got to take any action on it, but I want to go ahead and have it on there in case we needed it.
I think it was just preference in that county that they presented it.
Okay. About the report.
Sorry,
Go
we
ahead.
will have to take action because the interim report that's due, it is with expenditure categories. So I'm going to have expenditure categories even if we spend nothing.
Okay. Okay. Well,
And I'm
let's get-
assuming those can change later.
Okay, so item number 4 is discuss, consider approval and submission of expenditure report for American Rescue Plan Act. This would be a report that everything that we've spent and whatever the plan might be through the end of July. We've not spent anything yet, of course. We've got until the end of August to submit this report. Loretta says that she is agreeable, and I appreciate that, to send in the report. Anyway, we're now kind of the opinion that we may not have to get it approved by Commissioner's Court. Probably not a bad idea, at least y'all would know what's going on, but it's not required from what I can tell. But I want to go ahead and put this in here just in case I was told differently. And I did get something from Allison Bass yesterday afternoon that says that Jim Allison doesn't see anywhere where we have to have it approved by Commissioner's Court. But we've got it on there where we can talk about it anyway. So Loretta, tell us about that.
And I have a chart here, and what's due by August 31st is an interim report with expenditure categories. And basically, I need the court to tell me what expenditure categories y'all want me to start with. And Judge Fields had just read the categories. See if I can find mine. You have yours handy.
The ones about eligible uses.
Yes.
Support the public health response to the coronavirus pandemic. Address the negative economic effects caused by COVID by aiding workers and families. Replace lost public sector revenue. Provide premium pay for workers performing essential work during the pandemic. Invest in water and sewer infrastructure, and invest in broadband infrastructure. I think everybody probably has their own pet projects that they might think about, but those are some pretty broad guidelines as of right now.
And we just discussed public health, the assistance for public health, and that would be something that would begin our fiscal year. I know their fiscal year is over, but the hospitals. But it would be something we would need to go ahead and put in this budget as a category for that, if that's what the court wants to do. We've discussed premium pay for county employees, and we also discussed a few of the restrictions. It is for employees, work at home time does not count. And this can go, it can be retroactive to January 27th, 2020, I believe. So it's for people that were at work, and we would have to go back and calculate hours and then put an hourly amount on it.
What would be the hourly amount?
Well, and that's for the court, it's up to $13 an hour, but it can't exceed 25,000. So the court would just have to decide what hourly amount they wanted to dedicate to this.
That would be from January the 20th.
January 27th, I just saw it, 2020.
What about employees that's
Until
left
how long?
employment?
I mean, how-
And that would be another thing that would needed to be decided.
And I would think once they left, they're gone.
Yeah,
They're no longer eligible for it. But it doesn't say that anywhere in here, but
no, but are you opening yourself up for a liability by not, if you're paying everybody else at the same time?
well, it doesn't say we have to, it doesn't say we can't. I don't see what,
Yeah.
either way.
Would you say it one more time, the dates, Ms. Loretta?
It's retroactive back to January 27th, 2020. And I think that would be a commissioner's court decision. Do you want to give premium pay to people that have left?
Right.
And it's up to $13 an hour, not to exceed 25,000
For an employee?
per employee.
And it does say it can be retroactive, so it's allowable to go back. But, you know, if they've already separated work, they've terminated their employment,
Yeah, but how many of them don't come back and say, well, that's when I quit because.
Yeah.
Cause I'll pay, you know, and
But that was their decision to do, so it's really, we're having to kind of just make up the rules here for this thing as we go along. So we've got to come to a decision about that at some point.
And it keeps it going until when, Miss Loretta?
It can't go
well,
past,
it's up to $25,000.
yeah.
Yeah, $25,000.
So if you did $13 an hour, however many employees you got, how many months would it take to get to that?
It's 25,000 per employee.
For
Per employee.
I mean, that's what I mean though, how much would it take? If we went back to 27,
So you're not saying that we're gonna write a check out for each one of them, $25,000, right?
Yes,
Or is
that's
it-
what he's getting at, that's what
Yeah.
it would be.
That
Okay,
is-
So,
I'm sorry, go ahead.
yeah, I thought it was gonna be added to a certain amount of pay for the next, for so long.
No, that's what Ronnie's talking about. If you go back and you figure it, it'll be a one-time deal.
One-time check,
Yeah.
just like they get a
if you
regular
can do
check.
that.
Well, and keep in mind that we need to use some money for other projects maybe. The water and sewer infrastructure, broadband infrastructure,
Go back to the second one, Judge.
Man, what would that cost the county just
address
for
the negative
employees?
economic effects
I'm
caused by
sorry.
What would
COVID-19
that
by
cost the
aiding
county? just
workers
for
and
employees
families,
for
small
that
businesses,
money?
nonprofits.
25,000?
Yeah.
You can multiply that by
That's what I was trying to figure out.
1.25.
Says replace lost public sector revenue. Treasurer's guidance provides a new
2
methodology to
no,
calculate
just
lost
say
revenue.
1.25.
I think all we need at this point is just to decide some categories that we want to fund or consider funding. I don't think we're obligating ourselves to fund it.
No.
We are looking at the categories for the funding, and then the report's got to be done next week. So like Tuesday next week, it's got to be done before then. So we spent zero, but what are the categories that we are going to use? Well, all of these are eligible uses. We could just put all of them in there. We don't have to fund them all.
Right, and as far as revenue loss, it's going to be calculated as of December 31st, 2020 compared to December 31st, 2021. So, and there's a spreadsheet that I can just plug
Did
in.
you see the part about the new methodology from the Treasury Department?
I've heard about new methodology.
It says, Treasury's guidance includes a new methodology to calculate lost revenue
It's already
under
need to be
replacing
there.
lost public sector.
It's already there. This-
I haven't
once
seen what
again,
that
my
is. I
concern,
don't
Yeah.
know if
we
you've
haven't
seen it
spent
or
any.
not.
I have, and I've
Once
seen
you
the
spend that
spreadsheets,
first
and there's
dollar,
a lot
you
of other
become obligated.
factors in that also.
So if they come in here and they say, Ronnie, you're gonna have to wear a mask everywhere you go, and then they're gonna own you then. And that's what they're doing with everybody else right now.
They own us anyway.
Yeah. Well, hey, this is the federal government, not the state.
Well, somebody
That's
owns
over
us.
$3 million, isn't it?
Yeah.
31,250 times
We don't own
125.
land, we don't own
Let's
our
just say
house.
125.
Oh, I
That includes
understand.
part-time.
We don't own nothing. We're just here on this little earth.
Yeah.
But it
That's
depends on if you wanna go by their rules.
$3,906,250,
If-
which
if
is
there
more
was-
than,
If it didn't appear that.
well, we'll have
Yeah,
three and
we
a
don't
half
even have that
million.
now. We're going to have it at some
Well,
point.
What's gonna happen is
But that's a
we
decision
spend
y'all
it,
can
and they come in
make
here and say,
later.
well, you got these, or give the money back.
And don't forget about the cities also have quite a bit of funding that's coming in. Of course, it gets filtered through the state, but every incorporated city in the county is getting some money
Nothing.
based on
It's in there. I
population.
mean, it wouldn't
No,
cost
I
the
mean-
county nothing.
I know it wouldn't cost them, but how much would it be
It'd be 25,000
per
employees,
employee? There's how many?
Up to.
up to 25,000.
And
that's
that
capped.
time period, we're gonna have more than 125 employees because we've had, well, no, we won't.
But not if we only pay current.
Yeah, if we only pay current. So I figured it at 125 employees. But that includes part-time also.
Yeah.
That was actually employed January.
Back to January 27th, 2020.
if they hired after that, they will not get the
There's
pay.
800,000.
Yeah, it'll be retroactive too, so we'll calculate.
We got 1.7.
And when people were working from home, I had them keep their work at home hours
25,000.
separate from their work here hours. So I think if it comes down to it, Commissioners Court is just gonna have to decide a time period, and we're just gonna have to have a plan of during this time period, the people work this many hours, if they're still here or whatever y'all wanna do, get premium pay. But to answer your question, 25,000 at $13 an hour is 1,923, I think I took it off my calculator, hours, and we calculate a work year at 2,080, so it's like 92% of a full work year.
Okay, that's what I was wanting on, sir.
Yeah.
Yeah, but you're going all the way back till January of 20.
26th.
So you got way enough hours to
Yeah.
do.
So, Mr. Rare, would you pay them by every 2 weeks and just add it in, or would you give them one big check like that come up?
Since it's premium pay,
Mhm.
if we do one big check, taxes are gonna eat a lot of
Yeah.
that check, because our system assumes that's one pay period. So it's thinking you get 25,000, 26 times a year.
Right. So it's better to just do every 2 weeks? Add it
I don't know,
into-
we'd have to look at that on how to pay it out. I don't have that answer right now. But if y'all wanted to add the premium pay category, that would be fine. If you want to add the revenue loss category, we're not having to attach numbers to this right now. I mean, I will before I certify
We can
revenue.
probably add or take out another category too as the plan changes as it goes along. This is just our preliminary plan.
And the other categories were, broadband,
Yeah.
Broadband, water and sewer infrastructure,
Road and bridge.
So if the hospital's coming in and wanting money, are there anybody else gonna be coming in?
I would
that's just
anticipate
it.
the water district will want to come in and get a generator. I haven't not been approached about that, but I bet they were really struggling with electricity issues during Snowmageddon.
Well, and the other thing is, number 2 was nonprofits that lost revenue in the same time period are available.
So would nursing homes and any of that be, no,
Could believe it.
could be, or
No.
They get their own money, don't they?
what?
That's the problem. The rules are real broad right
Probably
now.
do.
One of the counties at my
What are
meeting, they were giving a $6,000 payment to each law enforcement officer,
What are the
$4,000
categories?
payment to all other employees, just to.
Do I need to write?
Just across the board.
it's just
Um,
discussion.
They were giving $20,000 to each volunteer fire department, and they were requesting paperwork on their fundraiser losses for the year. They were also giving $110,000 to the ambulance service and requesting an equipment list, a list of equipment that was needed. And they were reimbursing a portion of their payroll, and they were giving money to like Meals on Wheels, the places that had to go out and bring food to
Food.
people.
Do you mind saying what county, that size county that was, or what county it was?
I believe it was Taylor.
Well, okay, that's a whole
But
different.
I'm just saying, that was an example of what they were doing. I mean,
Right.
it wouldn't have to be those amounts, I'm just saying,
Right.
that was an example of what one of the other things.
Okay.
And I have on my listserv, I remember one county just giving $4,000 to each employee, instead of trying to go back and calculate hours.
Well, I think the employees would appreciate whatever we did for
You
them.
ain't kidding, I mean,
Yeah.
I believe so too. I mean, $4,000 is quite a.
And that would
bit,
help
not-
them stay on with us. you know.
Without trying to get into this $25,000 deal.
You might get some more applications or something, James.
Do what?
You might get more
I
applications.
might.
Well, and you can do that because we have to spend these funds by December, or we have to we have to
Here's the language.
Obligate.
obligate the funds by December 31st, 2024. You could do a premium pay fiscal year 22, you could do a premium pay fiscal year 2023. So you still have time to do that. I don't recommend trying to do it before the end of this fiscal year because I don't think my department can handle that.
So if we did something like a $4,000 and then like at the end of each, well, not this fiscal year, not that, but as far as the end of the year, just in December,
Right,
give them a bonus for the next
3 years.
Premium
years,
pay,
yeah. Yeah. 3
Premium
years.
pay, not a bonus.
premium
Premium
pay.
Okay,
Premium
Call
pay
it a
because they are
bonus.
performing essential work.
Yeah.
I mean, instead of going with just paying them out $25,000, I wouldn't.
We can't do that.
That's not gonna
That-
be feasible, is it?
That's gonna use up all the money for one
Yeah.
thing.
Yeah, so, but I mean, you take and give $1,500, 15, be 4,500 for
Over
three
3-year
payments, yeah. I think they would be happy with
I
that.
think
Well,
the
and-
employees would appreciate it.
Yeah,
Nah, they
And
wouldn't
it's-
like it.
A
don't think
smaller
so.
amount like that, I would suggest just
think so.
doing one payment. So like if you want to do it in December each of 21, 22, 23. um, But again, I think, are you gonna do it for just all the current employees as of December,
of this.
a date
this-
in
I think we
December?
need to think about
I
that some more.
don't think I don't think that would be respectful enough because they worked through this pandemic time,
Mhm,
Yeah.
which is what the funds are for.
Right.
That person needs to be paid.
right.
Do they
So-
have to
Even
be
if
a
you
current
took out-
employee of the county to
Okay.
receive the money?
I think if you were working for the county at that time, then you ought to be eligible.
Unless they tell us we can't because they have to be a current employee. Now, I don't see that in there,
They
but,
were a current employee when it come about.
but not current when we make the payment. That's, could be an issue. That's the problem with the rules. We,
Well, and if it's retroactive back to January 27, 2020, do we need to sit down and look at everybody that was employed and,
we've got to turn if they were essential.
well, yes.
And it can't be an elected official, an appointed official. I don't know about that.
I haven't said anything about appointed, but if electeds don't get it, I'm not taking it.
Okay.
Yeah, there's just gonna have to be a session to sit down and say, this is what the court wants to do.
Well, and I'm all for spending it. I just don't want us to get trapped,
We're gonna have to
I'm the
spend it.
doom and gloom guy on this end on the getting trapped deal.
It's just one letter off from crap right now.
Yeah, I'm telling you.
There you go.
Carpa.
on the deal. But I think that if we're gonna do that with employees, we need to look at the fire departments for sure, which I think would be beneficial for all of us, and look at the Meals on Wheels on program that we support, who absolutely worked every day through all
If we
that.
pay the fire departments, then we need to pay the EMS extra, because they're out there on the front line.
They can't even give us the reports.
But they'll come get you when you're passed out on the sidewalk.
Yeah.
They will. Okay, I think that's a discussion that we can get into the nuts and bolts, but we need to work out what we're gonna do for the report, which is just the categories. And I say just the 5 broad categories that they have here. I think it's 5. No, it's not
Public
5.
health, premium pay, revenue loss, negative economic
6.
impact, and infrastructure.
No, there's another one in there
Is there another
for,
Well, it's invest in water and sewer infrastructure, and then invest in broadband infrastructure.
Oh, water and sewer and I split those out, so.
Yeah.
So do you just want me to do every category for this report?
I would, you think you gotta do water and sewer? Well, you need a new septic.
Well, it says invest in water and sewer in one.
Oh,
Yeah, of course, I don't know anything about the sewer, but I would anticipate that the water district may come to us. And again, let's think about the cities. The cities are gonna get their own amount of money for their own same things, water, sewer, all that. But the water district doesn't get that because they're not part of the city. They are their own district.
Well, I'm gonna say this too, on like the hospital or the ambulance, I don't think it's right for them to double dip either, come here and ask us for money
Exactly.
and then go to the cities and say, well, we want money too for ambulance or fire, if we're giving them money on top of our stuff too.
Well, they may do that.
I
In
know
fact,
they
the
may do
first
that.
When Ted first started this conversation, I said, "Have you talked to the city of Eastland yet?" Yeah, and they said they don't have any money.
They got 800.
They're going to get 840,000 in 2 payments, but I think he means they didn't have it yet.
Yeah.
They don't have it yet.
Well, I'm just saying, and I'm not saying they would do that. I'm just saying it wouldn't be fair to pay them twice or 3 times or whatever on that. If they're going to come to us and ask us for money and we're going to help fund it, they shouldn't go to nobody else.
Well, I think the issue for the hospital, according to what he's told us this morning, and I've had this conversation for 2 weeks with Ted, they're about to run out of money. If they don't get some money coming in there, they're going to start losing their employees big time and start this diverting where they can't take any more patients in. So we have the money in the account. City of Eastland doesn't have it in the account yet. It is an eligible expense. Do we fund them or not fund them on the 7th? I'd like y'all to think about that some more,
Why did we get ours before Eastland did, Judge?
because we are a county,
There
because
you
it's
go.
a city under 50,000.
I thought it was you had some pool or something, and that's
I
how
had
you
no
got
pool.
that problem.
No,
I
that's
have no
part of the
clue,
scary
nobody.
thinking about.
Yeah.
No, it's because I gave him my face.
Oh, there it is. Should have known, Loretta.
That's why we didn't use my face.
Okay, that's good.
They did it to all the counties in Texas, you know,
County got it
skipping
all.
the state.
Really?
Yeah. It went direct from the treasury
Went
to
direct
here.
from treasurer to them.
Nice.
So there's a reason
Yeah.
for that.
Yeah. That's why I was asking what the reason was.
It's a few months late though than what they told us. It was.
Yeah.
That's what I was thinking too. At
Yeah.
that conference in April, they said, well, you're gonna get it in May,
Yeah.
and it'll just show up one day, and you don't have to even apply for it.
Yeah.
And then later, Loretta says, I've gotta have my face scanned to apply for this. I said, no, you don't. It's gonna just come in. That's not the new news I just got. I've gotta have my face scanned.
Gave him my social security number.
Yeah, that's how I'm gonna do it.
Uh-huh.
Well, they're coming after you then.
Yeah.
Well, I said if I ever disappear, just contact the treasury because they have all my information.
So let's take a vote to include all the eligibility categories that they tell us that we can have eligible. And then the report will be that, and then the expenditures will be 0. Correct?
Yes.
Okay.
Yes, we have no.
Ain't mine.
Can we get a vote on that?
Oh, it's mine. Sorry.
Miss Donald?
I know it's mine. They're vibrating.
Can we have a motion to,
Motion? Yeah.
can we have a motion to add all of the categories under eligible uses for ARP into our plan and to
Eligible,
submit the report? Yeah, eligible uses
eligible
under
uses
ARPA into our plan.
under ARPA?
Yeah, ARPA, American Rescue Plan Act,
Oh, okay.
and
And
submit the expenditure report, which at this point, no funds have been expended. Can I have a motion of that?
I'll make it.
Yes, sir.
All right, and you've got a second?
Robert,
Or do you make it?
I do first, I'll let Ronnie second.
Make it Ronnie second. All in favor, say aye. Any opposed, same sign, and that carries. Okay.
And those categories will be what? Can you make me a copy
I
of
think
that?
that'd be a great idea.
Okay.
Okay, I think that'll be a great idea. I'll just make you a copy of
Okay.
this whole packet right here, that way you'll have it.
Okay, that's
Okay.
perfect.
Okay.
Well, I looked at that agenda, I thought it was gonna be a short one. This is
I
long.
know, I knew it was gonna take a while. All right, item number 5, are we through with that already? You have what you need?
I have what I need, thank you.
Item number 5 is to discuss, consider disposing of some tables, chairs, desks, computer, lumber. And Donnie's been patiently waiting back there. Donnie, come on down.
Sure you don't want to break on mine?
Tell us what we've got.
Thank you, Don. Watch him turn it
Just-
around, maybe
yeah.
fall.
He wouldn't do that. Donnie's good guy.
Just a bunch of stuff that's over at the annex in the basement. They got water damage and been just stacking up. Just dispose of it. Well, I still have some funds in my account to get rid of it and pay for a dumpster.
So your plan is to put a roll-off over there and have some help and load it?
Yep.
Tables, desks, chairs, sinks, laminated flooring, 11 boxes of computer parts, old phones, light fixtures, 8-foot bulbs, gallons of paint, window units.
Well, the window units are gonna be auction. Should
Okay,
be on a separate deal for them to
Okay.
be auctioned, but get them all together so we can put them on the auction.
were they damaged during the water? Did they get underwater?
They just been over there for
Oh, okay.
years and we ran them through before to dispose of them. Just never done anything.
Do you have a list that I can get
Of
of the items?
just,
It's,
there's nothing that has access numbers on them.
Okay, I still need to,
like the
I guess,
computers.
for the documentation, can I just make a copy? Is that all right?
Sure. Okay. Gentlemen, any other further questions or comments for Donnie?
No.
Can we have a motion then to dispose of these water damaged items? And also do you want to put the computers up on the gov deals?
I don't think, they're just so monitors.
I'm sorry, not computers, the HVACs?
Yeah.
Okay. And put the HVACs on gov deals.
Yeah, and then I'll go through the access numbers and make sure they're all been put in before.
Any questions or comments? All in favor, say aye.
Yeah.
Any opposed, same sign.
Who made
What
the
is that?
motion? Andy?
Yeah.
Who's second?
James.
James, okay.
Came from Kathy's stuff.
you.
All right.
Oh, then Kathy had an ID deal on there for the cabinet in here that got
Oh, that little
broke.
table that fell, yeah. And that's part of it. Okay.
You'll need that also.
Was she dancing on the table again, Judge?
I didn't hear what.
It's a little printer table that collapsed, its particle board. It finally collapsed with a little bit of weight.
That's what I asked. Was you dancing on it again?
No, Robert. But I think you might have gone there and sat on it. Oh. Right.
That's
They
not
poked
true.
back.
That's not true. They'd have found me in the treasurer, or the tax assessor's office below.
It did open up some space in there. Well, we stacked too many boxes of paper, of copy paper on it, and it went, fell in. Okay, anything else on that?
No, sir.
All right, thank you,
Get it.
Donnie.
Thank you.
Go get it done.
Get it done.
Get it done, get her done.
Donnie, would you
Yeah. I'll
communicate
give
with
it
her when it's gone?
Okay, item number 6 is, I don't know about this one. File order appointing Assistant Auditor Pam Floyd. That name seems awfully familiar.
Who is that?
Yeah, that might ring a bell. She was an employee a long time ago. No, I asked Judge Herod if I could get Pam back just to help with the open enrollment, getting everybody in. We have to do a lot of accruals for year end. If there's any pay changes, which there are minimal, to put those in, make sure everything's right. And Galia hasn't been doing this long enough to be comfortable. So I have budget. It's just getting Pam in temporarily until September 30th.
I've got to think about this one a minute. Okay, I thought about it. All
I'll
right,
make the motion.
Okay.
all right, we have a motion
Okay, motion to accept.
and motion to accept the order
Okay.
signed by District Judge.
And was anybody missing that order?
I got it.
Okay, I have an extra one, that's why I'm asking.
Andy did.
All in favor, say aye. Any opposed, same sign. When will she actually start?
Today.
Today. She's in there now? She might want to come in here and introduce herself to us. Pam's back.
I got a hug this morning.
Did you?
Made my Monday go
I have
good.
not gotten a hug.
I did.
Wow. All right, item number 7 is a 911 update, cooperative dispatch update. And Sheriff said he wouldn't be here because he's going to a funeral this morning. And so I don't have any reports or records from the sheriff or from dispatch. So anyone else on 911 or cooperative dispatch? All right, no reports or records on that. Then Donna, item number 8, up down the county burn ban. Parts of the county got a tremendous rain and parts did not. What do we think about on the burn ban, everybody?
I need to take it off.
Okay, we've got one for taking it off, and what else? Anybody else?
Yeah, it don't make any difference. I think we got plenty of rain, but
Does anybody have any
Let's see,
updates from the fire departments? Do they want to take it off, leave it on?
I
What
haven't
they
heard
say?
anything.
I haven't heard anything either, so.
Most county got about 5 to 6 inches, what I heard.
Yeah, we got a lot.
All right, so we've got a motion to remove the existing burn ban. Do we have a second?
I'll second.
We've got a second. We've got a motion and a second to remove the burn ban. Is that effective immediately?
Yes, sir.
Effective immediately. Any further discussion? All in favor, say aye. Any opposed, same sign. And that passes. And I'll have to get, Donna, I'll have to get an order drafted and
Okay.
get that sent to you.
Okay, thank you.
Looks like they're 20s and 30% chance all next week,
That's awesome.
every day.
Tell us
It's
to
been
go
an
somewhere
awesome
else.
year.
I'm tired of messing with rain.
Golly, James, we don't want to be in a drought.
All right. That takes us down to number 9. Discuss, consider signing the FY 2022 savings agreement with the Office of the Attorney General of Texas. No, wait. That was on last week, wasn't it?
No.
Is that right? Do I have that on here?
Yes, you have it on there. And that's the DocuSign document that
Ah,
you need permission to sign.
Forgot what he said.
I know, man. It's terrible.
So that is through the Office of the Attorney General. It's a grant we sign every year. It's for the victim information notification. We'll also get a contract from APRIS. I believe APRIS will do it again this year. So Judge Fields just needs permission to DocuSign.
I didn't sign it. I was waiting till today. It's sitting in my e-file. Yeah,
That's what we
that's why
discussed.
I don't have it in here, because I didn't print it off. I would have to go in there and sign it and all to get it printed off. Okay. So I need a motion to allow me to sign fiscal year 2022 savings agreement with OAG. Can I have that motion?
I'll make the motion.
Do we have a second? All right, motion made and seconded to allow me to sign that agreement, Donna, with Office of Attorney General for SAVNS fiscal year 2022.
Okay.
All in favor, say aye.
Aye.
Aye as well. 4 of us at the table at the moment.
Yes.
Okay, on number 9, we've got number 10, discuss, consider adopting an order to approve online education for county commissioners. Okay, so you remember last year, we finally got it passed to where you could get online education. If we want to continue to have online education, they now tell me that we have to sign an order that allows online instruction except during a county commissioner's first 12-month period. So do you want to continue to do online instruction for county commissioners? Not me, just commissioners.
I'll make the motion, we allow it.
Second.
Motion made and seconded to allow and order online education for county commissioners. And go, Donna, get caught up,
Bonnie, okay.
and to allow me to sign the same.
Okay.
All in favor, say aye.
Aye.
Any opposed, same sign, and that carries. Okay. It was 5 and 0 nays. And Donna, I'm gonna sign 3 of these and give them to you, if you'll get me one back.
Oh, yes, sir.
We got a bunch of pressure and everything. Got in the creek. We got
Well, there are three of you to attest to right there.
And one comes back to you.
Yes, ma'am, please. That way I can keep it on file if we ever need it, I guess.
Okay.
Okay. Item number 11 is personnel matters. Ms. Keith.
Yes, you each have a report. The time period for that report is August 4th through August 17th. During that time period, there was one part-time Precinct 1 road hand new hire and 2 employment terminations. One was a full-time deputy sheriff and one was a full-time jail guard.
All right. Anyone else have any personnel matters to discuss this morning? All right, hearing none, can we have a motion then to accept this personnel report as presented by the auditor?
Motion.
Second.
Motion made, seconded, all in favor say aye. Aye as well. 12A is certification of additional revenue. Right back. Go ahead.
There is one certification. It is $4,936 received from Texas Association of Counties Health and Employee Benefits Pool. It's deposited into general fund, credited to the insurance renewal credit revenue line. I'm asking, this was for a 2020 surplus distribution. I'm asking the court to increase the contingency payroll expenditure line by the same amount.
Can we have a motion to accept that?
Motion.
Second.
Motion to accept that and
Allow
The-
judge to
and
sign.
allow the judge to sign it. All in favor, vote aye. Aye. B is emergency amendments.
No emergency amendments.
C is amendment changes by fund.
Yes, we're up to 3 pages of those now. You'll see in the far right column under description, some of these are certifications of additional revenue from previous court. There's adjustments within budgets. Right now, if there's overages, when I get paperwork ready for Commissioner's Court, I'm just adjusting for overages. And I did correct the Precinct 1 $4,499 and made it $44.99, and you can see it took me a couple of tries to do it.
Can we have a motion to make the amendment changes?
Motion.
Second.
Have a motion to make the amendment changes by fund. All those in favor, vote aye. Aye.
Oh, sorry.
Oh, you're good. You're good.
You gotta sign that.
There you go, James.
Did you say and sign? Did you
Yeah.
have to do and sign? Now we're at
Judge needs to sign it. Or no?
I think he does.
We're on D, Judge.
All right, thank you.
He needs to sign that one too.
All right, thank you.
I think we will. Thank you.
Thank you, ma'am. On D or B?
D.
D.
D is in dog. Report of financial condition, Ms. Key.
Yes, this is our regular meeting report. It's general ledger balances as of August 22nd. At that time, general fund checking, general ledger balance, $2,679,669.48. Tax pool, $331,058.23. First Financial Bank CDs, $847,263. Texas Bank, one CD, $250,000. Schertz Bank CD, $250,000. Prosperity Bank CD, $250,000. Tax pool prime, $521,148.13. Texas class, $510,070.70. Total general ledger balance, all funds on deposit for general fund, $5,639,209.54. Road and bridge checking, $347,314.46. One thing I do want to bring to your attention is just below the U.S. Treasury ARPA grant. It's Fund 026. The ARP funds checking, $533,129.34. First Financial Bank CD, $750,000, and Texas Class, $500,000. So the total for the ARPA grant is $1,783,149.74.
That's what your funding is on that.
Thank you, sir.
And then
That's a new fund, is that?
New thing, okay. Thank you.
Yep.
there are
Sure.
several pages, the rest of the funds are listed, and then on page, is it 4? There's one total line. Total funds on deposit for the county, general ledger balance, $11,549,530.05. And then there are 2 totals pages. Is it 2 or 3? 2. And the next report is the combined statement of revenue and expense. Also, as of August 22nd, you can see the month-to-date revenue and expense by fund. And then the year-to-date revenue and expense also by fund. As of August 22nd, general fund expenditures, $8,948,060.61. Expenses, $7,923,762.22. Road and bridge revenues. Did I say expenditures twice that time? I did. The first number was revenues. Road and bridge revenues, $1,498,184.97. Expenditures, $1,425,161.76. So we are within about $73,000 of working on fund balance in road and bridge. There are 3 pages of that showing each fund. And then the next report is combined statement of cash receipts and disbursements, also as of August 22nd, showing the August beginning cash balance, cash receipts, cash disbursements, and ending cash balance by fund and account type. And as of right now, we're still in a good revenue and expense position and cash position. And then the last report is the schedule of payments listing the one general fund lease purchase agreement, which is now paid off, and then the 4 lease purchase agreements for road and bridge.
Why don't we use some of that money to pay that off, Judge?
You can't.
I just wish.
Oh, you wish. Oh, yeah.
Yeah.
You're wishing. All right, gentlemen, any questions or comments on this report ending as of August the 22nd? Can we have a motion then to accept that report in as presented?
Motion.
Second.
Motion made and seconded. All in favor, say aye.
Yeah.
Any opposed, same sign. And that carries. 12E, investment report.
No report at this meeting.
Not this time. 12F, financial reports. And Donna, I may need a little help on what you have compared to what I have. I've got a collection register for the Eastland District Clerk. Looks like that.
Okay, nope, I don't have that.
I'm gonna give that one to you.
Okay.
This is the registry of the court, for district court. I don't know if you have that one or not. And this is the same thing about the balances as itemized
Okay,
for the
no,
registry of the court for district court.
okay.
That's there. Then I've got a report here that are collections from the Eastland District Clerk. That's
No,
this
sir.
one?
No. I've only got one.
Okay.
And then I have two from the DMV.
I may not have those. Let's see here. These are the payables. That's budget. Okay, and you got two for the DMV?
Yes, sir.
Okay.
Two for the DMV.
All right. Look through the rest of your stack and make sure that we're not missing one
Oh,
that you and I either one haven't talked about.
What is that?
Is that, it says 45, but
It's a different.
On item 16?
yeah.
Yes, those
Oh.
were
Okay, that's
the,
it?
that DMV was the only two that I had.
Just checking before.
So,
Okay.
Yes.
So for those financial reports, can we have a motion to accept them as presented?
Motion.
Motion made and seconded. All in favor, say aye. Aye as well. All five of us agree on that. Donna?
okay, all five.
All five. Number 13 is bills, claims, and accounts. Ms. Key.
You have four sets. The first set is payroll. That's all payables other than workers' comp and unemployment. The second set is payroll gross wages. The third set is com data, and it's dated August 4th, but it will be paid today. And then the last set is regular payables for today. It's dated August 23rd. I do have a few changes to this report. And Donna, yours are marked.
Oh,
and
okay.
initialed.
So you're
On-
bringing that in at that point? That's that tax that we had to rebate back? Is that coming back out through the payments? Wasn't that
Oh,
where that was
yeah,
gonna come
it
out?
was already, it came out through
Okay,
payments, yes.
okay.
On page 3, and if you'll go down to Jason Weger, the third line, and this is just a description change. It says reimburse/parking. It should say parking/sheriff conference. And then on page 5, Rico USA. And I believe it's the third line also. This needs to be changed. The account number needs to change from 010-490-481 dues and subscriptions to 010-490-462, which is equipment lease.
That's the one right above it, equipment lease?
Yes.
Okay.
Yeah, that one needs to be equipment lease. And then at the bottom, Texas Department of State Health Services. This is a description change also. It says June 2021 remote B/C. It needs to say June 2021 birth certificates, BIRTHCERT. On page 8, FedEx. This is an account number change. It needs to change from 020-621-362, which is tires and batteries, to 020-621-361, which is barn supplies. And then the last one is on page 13. And it's Eastland office supply, and it's the third line. This is an account number change. 044-585-456, which is equipment repair. There is no budget in that line. It needs to be charged to 044-587-456, which is also equipment repair, but there's budget. That's all the changes I have.
Okay, Donna, did you keep up with all those?
Yes, sir.
All right. With those changes, can we have a motion to pay the bills, claims, and accounts as presented?
Motion.
That was close.
I'll do, you second.
Okay.
Ty goes the runner.
Yeah.
All all in favor, say aye.
Aye.
Any opposed, same sign. All right, and that carries. Okay. Anything else on 13 bills, claims, and accounts?
Not for me, Judge.
Okay.
Would you?
What is your way? One more.
You don't have this.
I don't know what you got there.
Does Robert get one of these? Does Robert get one of these?
Yes, I gave 3 to Judge
Oh,
Fields. Would you give Commissioner Raines and Commissioner Wilson?
Oh,
Trying to keep him
sorry,
yourself,
Ronnie.
Judge.
I'm trying to figure out what she's doing.
Yeah.
And I am in no way telling you how to vote. I just have to have this prepared so y'all can sign it. So if it changes, we'll have to break and I will have to go correct it.
Okay, that takes us to item number 14, public hearing on fiscal year 2022 budget under Local Government Code 111.07. Anyone here for public comment?
Christina.
All right. Julie, I think that would only be you. No, Julie's not saying
She's
anything.
asleep. Y'all didn't wake her up.
All right. There being no one here making public comment, then we will move on to item number 15, which is adopt fiscal year 2022 budget and file a copy with the county clerk and the auditor. Ms. Key has prepared this for us, and we have it before us.
I have a couple of changes before adoption, Judge.
Okay?
On page 31, which is the sheriff's budget,
31.
All right, I think we've all got it.
okay? Line item 010560151, cellular phone allowance. I need to reduce that $5 to $4,645.48.
Wait a minute. You said you need to reduce that 5,000 to 4650.
I need to reduce it $5 to $4,645.48.
4645, right?
Yes, 48.
48. Okay, so it's $4,645.48.
Yes.
Okay.
And then on page 32, I need to add line item 010561151 cell phone allowances and put that $5 on that line.
So you're making a new line item then?
You're making, oh, okay.
I'm adding a line item.
Okay.
And that line item is going to be 2022-010-561-151 cell phone allowance.
Yes.
Okay.
And the reason for that is, Sheriff Wager did not include a cell phone allowance for the jail, and I'm trying to get all of the jail expenditures in the jail budget.
Okay.
And then on page 72, line item 039562424, I need to reduce it $5 to $1,095.
72.
72. Are you missing page 72?
It says 72, but it's not.
Should look like, which version are you on?
Yeah, that's 72. You got the same thing?
Which version do you have?
They got my copies of version 2.
Oh, okay. In version 3,
Right.
and this will actually be version 4 with these changes.
Read that line item again.
039562424
Okay.
cellular phones.
Gonna reduce that by $5 to $1,095, don't it?
Okay.
And then add 039562151.
Oh, add that line.
Yeah, it's in
Okay,
addition.
I'm
Okay.
sorry, what was the last three numbers?
151.
039
562
562.
151.
Putting $5 in that one.
Yes, that'll be cell phone allowances, and put that $5 in that line. So the changes are not going to change total expenditures at all,
You're
just moving them
kinda
around.
moving it, okay.
Adding some new lines for better accounting purposes.
Yes.
Oops.
Okay. Ms. Key, anything else for us to consider before we move for a vote?
No, sir, and the budget certification is pages 1 through 3 of the document that has the sign here's on it, says adopted budget.
And the tax rate is .459, which we'll get to in a moment.
My only thing is looking at the sheriff's deal, it looked like we left the 3 cars in there, and I show that we didn't. That, no, I mean, they may not be on your version.
It probably is. I don't think we ever had definitive take it off.
Let me look at it real fast because
Cause it's still showing 180,000 in there.
oh
and I-
yeah, no, we did not. We never.
There was never a definitive decision on that, so we didn't change it. And I know what he's trying to do is buy vehicles off a grant, and it's a 35% match. So he's trying to get more vehicles. But he's not here to explain it.
Whatever. I just know we talked about knocking it down to 2.
When he has that new patrol vehicle, it's not new, it's the old
No, he just got a new
Tahoe.
one.
He's got an old Tahoe that came from the,
No, he just got a brand new
no,
one.
no, well, I know that, but he's also got, he's using that old Tahoe that came
Yeah.
from the interdiction unit.
Yeah. Well, I showed it, didn't I?
No,
No, they're
Oh.
using it.
Oh,
no,
They did a
what,
swap between Sheriff Bradford's old white pickup for the DA's office to drive,
Oh, okay.
and then took that Tahoe and put it in the SO for them to use.
Okay.
Now, the new Tahoe, I think he's trying to spend that out of this year's budget. He's
Yeah,
already
that-
got it, so.
that comes
Yeah.
out of fiscal year 21 budget.
Right. Right. If we leave it in there and he doesn't spend it, it just goes back into fund balance. We probably need to bring it to his attention.
Yeah.
We're not anticipating him wanting to do that unless we want to just take it out right now. You know, that's
Well,
been,
if we leave it in there and it gets 3 cars, he's gonna have a hard time selling me to get anything more than 1 next year.
if he goes over what we talked about.
Yeah.
Well, he's at the funeral, and I doubt that I can get him on the phone.
No, I mean, it's 10, 1/2 dozen of it.
I think, Robert, if we talk to him, I don't think he'll do it. I don't think he'll go over it.
He won't have to.
Well, I mean, I don't think he'll go over what our original plan was back in June, which was,
Well, and
The
I mean,
grant.
he is trying to get the grant and stuff, I know,
if there's a match, he's gotta have some money in there to do the match.
Yeah.
So how much do we leave in there? That's unknown.
yeah. Have we heard anything on what the Cisco Volunteer Fire Department reduction is gonna do to workman's comp?
No, I have to have lists from all the departments to try to extract.
Cause they
A number.
called and asked this morning, cause they have their first budget deal this afternoon, or tonight, and they were wanting to know. I told them I'd ask.
And today's the deadline, so I don't know what y'all want me to do.
We've sent out multiple requests from this office to try to get them to get those reports, and we've gotten most of them back, but not one from Cisco.
No, not one from Cisco. Have we gotten one from Eastland?
I
Yes,
believe
we
so.
did.
Yes, we did.
So got hanged
The
up.
rosters, yeah.
But you won't have to need one from Cisco if we're dropping them from it.
I know. I think that's probably why we're not getting one from Cisco.
Yeah.
But I need one to know how many people would have been included, because it's gonna be a numbers comparison between what we would have done and what we will do.
Well, I asked all 8 departments to send me in a roster of people that are active, not honorary, but active people.
So, no, I don't have that number yet. Answer that. And I do know, in discussions with Sheriff Weger, the vehicles he's speccing right now are like 62,000 each. Those are 4-wheel drive.
For the grant.
Well, for all of the vehicles, yes. So he's trying to get 2, and then I think 2 more on the grant.
Get 2 through the county budget and 2 more from the grant.
But it would have the 35% match.
But he's got 3, but
He
he's got.
said he Walter's watching, he said he emailed that roster to y'all.
When?
When?
That's a good job.
I was checking everything as of Friday. I didn't see it, but he may have sent it up to Kathy's office, so.
No, he sent it the day they were here, cause he sent it to me too. It's been a couple of weeks ago.
I sent them all to you guys, so.
Okay. I don't remember. I've just been forwarding them to Gately.
Yeah. Okay. What about the sheriff's? He's got now budget for 3 vehicles.
I'm good with it. I mean, that's fine.
He was gonna buy 2 vehicles and then get 2 more from the grant. So if he does the grant, then it's a 35% match. And that was
A week ago.
a week ago.
Yeah.
It's like an old telephone, you holler through it and it goes all the way down there.
Okay.
Hold your ear up there.
Any other questions or comments before we move forward?
You good with that, Robert?
Yeah, I'm good with it.
All right. Do we want to move forward with adopting the budget?
Do we have to make a motion for the changes, Judge, or will it be all together? For those
Unless Loretta
changes.
did.
that
Let's go ahead
was-
and make a motion to make the changes as outlined by Loretta for version 4.
Motion.
Second.
Motion made and seconded for the changes. All in favor, say aye.
Aye.
Any opposed, same sign, and that carries. Okay,
Are y'all going to leave that line alone? for the
Yes,
vehicles?
ma'am.
all right, we've got this motion here. Who wants to read the motion into the record?
I'll read it, Judge.
Okay,
I move to adopt a fiscal year 2022 budget that will require raising 55,531.36 or 0.81956% more revenue from property taxes than the fiscal year 2021 budget.
all right, made by Commissioner Raines, do we have a second?
Second.
Second by Commissioner Maxwell.
Well done there, Robert.
All right, and for the
We've
vote,
already
we'll
got
do
it
a
big,
roll
right?
call. We'll do a roll call vote. Commissioner Raines, Commissioner Maxwell, are you in favor?
Yes.
Commissioner Crenshaw, are you in favor?
Yes.
Commissioner Wilson, are you in favor?
Yes, sir.
Commissioner Raines, are you in favor?
Yes.
And I'm in favor as well. So the vote is aye, and it's all unanimous. Okay? With that, then, we need to sign these for the budget certification.
And Judge, when I write this motion down, do I put it as adopt or motion to accept?
I'm gonna let you have it.
I've got one. Just do it like this?
Yeah.
Okay.
Motion to adopt.
Okay.
Now we will circulate the budget certificate for signing,
And that's the only one right now.
Oh.
and it's got to actually be notarized.
Do
So
I-
we'll get Linda to do
Do I have
that.
one, Loretta?
Yeah.
I have one?
Yes, you
Okay.
And you might wanna just wait and circulate the whole thing
After we vote on
after
tax rate.
the,
Oh, okay.
Okay.
Gonna do it one more time.
All right, so is that all we need for item 15?
yes, sir.
Okay, then for item 16, that is to adopt the 2021 rate.
And I have a typo on the motion wording. I have 45.0000. It should be 45.9000 or 9.
Yeah, that's it.
45.9.
45.900
00.
cents.
45.9.
And just add a 9 right after the decimal place.
Okay.
Yep.
0.
Okay. All right. Motion made.
I move we adopt a 2021 property tax rate at 45.900 cents.
Do we have a second?
I'll second.
Motion made, and seconded. All in favor, say aye. Aye as well. Mr. Maxwell, aye. Mr. Crenshaw, aye.
Yes,
Mr.
sir.
Wilson, aye.
Aye.
Mr. Raines, aye, and I as well, so it is unanimous. Okay, and then we'll sign this and send it around, and we'll need to get it notarized.
If you want an original, I put sign here's on them. I will include a copy in everybody's budget.
Did you notarize? Thank you. You ready?
This
All right.
page here, would it fall
You're watching them
after
sign?
this page?
Thank you.
With what they're signing? Or would it go
It's-
before?
It's gonna, well, it goes with both, so I.
Both, okay.
And Donna, I did do,
Yes, ma'am.
oh, I need this, deputy county clerk on this.
Okay, thank you, yeah. Do I need to put the commissioner's seal on it?
It's
Do you know?
notarized.
Oh, okay, somebody will know.
Yeah,
Okay.
Linda's waiting to notarize it. Once
Okay,
everybody's
cool.
signed off on it, she's watching you sign.
You watching me?
She's watching you sign.
Oh, there's one for y'all.
I think that's the one that started you, Judge.
Okay. Let's see, anybody else? Who all does this need to go to? That's all signed. Okay. That can go directly to Donna.
Okay.
She's waiting to get notarized.
I'm just gonna get Linda to come around here and
Oh.
notarize everybody off in the corner. All of them gonna wind up over here.
Okay.
Oh, okay.
Come over and sit down.
Linda?
Yeah, sit right over there. Come on.
That's the
Come on,
hot
sit
seat.
down right there.
Sit down, Linda.
Okay, Judge, here's your
Okay.
time. Swear in.
Place her on the row.
Yeah. Admonish her.
Do we need to swear?
Yes, will you all raise your hand and swear this is your true and correct signature?
This is.
All right.
Swear.
Thank you.
All of you did?
Yeah,
Yes.
yeah.
Keep an eye on them, Doc.
Did you speak up, Ronnie?
I did.
Okay.
I was the first one to say yeah.
First one.
I swear at Ronnie at least once a day.
Gotta get a job
Does.
done. He goes, golly, I'm stuck to do as good as you.
Is that it?
I use some adjectives when I got their names in there, but I don't know if golly is one of them.
And Loretta, I guess you'll have to redo
Bum is
that.
in there,
We'll
so
have,
you're
we'll
right.
have a
Love.
version 4
Yes.
Or
I had a lot of paperwork
to
to go
put
through.
in.
One more.
I don't want to do it all.
15 down, one more to
More to
go.
go.
He's getting cell phone dispatch.
Okay, okay.
I hope by the end of the day, if not, it'll be first
You
thing
think
in the
so?
morning.
Haven't decided yet.
Don't hurt.
I'm shooting.
Gonna have to get better than what it's been lately.
Is that it? Just three?
Need some more rain, you
Yes,
say?
and that's
Huh?
Donna's.
You want some more rain?
And that
Might
was
as well
Judge
just watch
Brown.
it. Yeah.
Thank you, Linda.
Thank you, Linda.
Thank you, Miss Linda.
Thank you, Linda.
Be on the video.
Call her Linda.
I know.
Linda
you're-
Lou.
Does everybody have a copy now? You have your copy, you have your copy, your copy,
And I have,
and you've got your
Got a
copy.
copy.
Loretta's got her copy.
yes, sir.
Okay. Loretta, have we covered everything now, so I don't have to have an extra meeting before we leave?
Yes, sir. We have covered everything.
Everything.
And more, probably. All right, with that then, can we have a motion to adjourn this meeting?
Yes, sir.
Second.
Motion made and seconded to adjourn. All in favor, say aye. Aye as well. It is unanimous. We are adjourned. Thank y'all for your hard work on getting that to go. Loretta, thank you very much.
Yes, sir. It takes the whole office.
15 down.